Minnesota nurses are at the forefront of the COVID-19 fight. Mary Turner is the president of the Minnesota Nurses Association. She joins me now.
I'm an intensive care nurse at North Memorial in Robbinsdale on that hospital's first COVID unit. So we've been dealing on my floor with the COVID since beginning of March.
Mary Turner says nurses are navigating uncharted territory, trying to keep up with the amount of COVID-19 patients seeking treatment.
North Memorial in Robbinsdale has anywhere from 13 to 20% of all ICU COVID cases in the state.
North Memorial has 4 ICU units, and they are filling up fast.
We have nothing but COVID cases on my floor.
The ICU nurse is worried that North Memorial might not be able to keep up with the demand of COVID-19 patients.
We're going to be up to full capacity where we'll have all our beds full, I'm sure, within a month here.
Turner's also concerned about the supply of personal protective equipment.
We have to stay healthy. Like when I get done with my weekend, I will basically quarantine myself for like 3 to 5 days to make sure I don't have any symptoms.
This is concerning for the Minnesota Nurses Association, especially since elective surgeries restarted this week.
It's going to cut into the PPE supply. We don't want them to ramp up. This cannot be business as usual.
Turner, like many other nurses, is doing everything she can to protect herself from the virus. According to the Minnesota Department of Health, more than 1,300 healthcare workers have tested positive for COVID-19.
I will go back to work tonight, and I'll have my bag with my 3 or 4 N95s that I switch out. I'll use one tonight, and then I won't reuse that particular one for 96 hours.
The nurses are working longer hours, and it's taking a toll mentally and physically.
If you become a patient in the ICU, you cannot see, you cannot have any contact with your family.
And that is sometimes the hardest.
It's very heartbreaking, and it's emotionally and spiritually draining on the nurses because we're not only being their nurse now, being all of their emotional support also. We've had stories of nurses standing in the corner of the room just sobbing because they're listening to the last words that are being said, over the phone to their loved one.
People can help the nurses by practicing social distancing. For more information on COVID-19, check out our social media pages or log on to ccxmedia.com. Sonia Goins, CCX News.
Find more local news stories at ccxmedia.org and follow us on social media.